Well, the big question is, have you ever considered that type 2 diabetes is actually preventable and in most cases can be reversible? Well, you can tune in by every Friday at noon for our 15-minute live session to find out the answer to this question.
So we're going to say it as it is. Type 2 diabetes is completely preventable by making comprehensive lifestyle changes, without drugs, without surgery. Yes, we said it every Friday at noon. We'll keep saying it. Plus, we'll give you the evidence, the practical steps you need to take control of your type 2 diabetes.
I'm Dr. Lynne, emergency medicine physician, and I'm here with my lovely co-hosts, Dr. Erica, GP from the West Midlands, Lynne, lifestyle medicine nurse from Glasgow, and Petya, lead diabetes dietitian from Coventry. And today we are going to talk about the different types of diabetes. And I'm sure you have heard of type 1 and type 2 diabetes, but there are quite a few more types. That is because there are many reasons why the blood glucose can increase. To understand diabetes, we need to better understand which specific tissues in our body are affected by high glucose levels. So by understanding our glucose metabolism and insulin resistance, we can divide the types of diabetes into 4 main types that we see in the Western world. Those are type 1, type 1.5, gestational diabetes, and type 2 diabetes, which we will divide into 3 phases: pre-diabetes, type 2 diabetes without in the need for insulin injections, and type 2, which requires insulin because it's insulin dependent. So we're going to start off with addressing type 1 diabetes. Erica, would you tell us more about type 1 and type 1.5?
Sure. So both type 1 diabetes and type 1.5 diabetes are what we call autoimmune diabetes, which means that our immune system is actually attacking the cells in our pancreas that's responsible for producing insulin, which is needed in, well, insulin has many functions, but one of its main functions is to get glucose, which is sugar, in our bloodstream into our cells, such as our liver cells, muscle cells, and so on. Type 1.5 diabetes is also called latent autoimmune diabetes in adults. And it can be thought of as a slower progressing adult onset type 1 diabetes. So in type 1 and type 1.5 diabetes, the body is not actually producing insulin, which means that we are now needing outside sources of insulin to perform that function. And this outside source is the insulin that we inject into our body. And type 1.5 diabetes is unfortunately often misdiagnosed as type 2 diabetes. And it's estimated that about 10 to 30% of people diagnosed with type 2 diabetes may actually have 1.5 diabetes. So why does this matter? It's because that the medications that we start people on for type 2 diabetes are designed to actually get the insulin in our body to work better and improve our insulin sensitivity. But if we're not actually producing that insulin, these tablet medications are not very useful. So these patients don't usually respond very well to the medications that we provide them for the type 2 diabetes that we've misdiagnosed them with. And also they generally have higher blood sugar levels as well.
And why are these 1.5 diabetes, or in some clinics they call them LADA, latent autoimmune diabetes, as you mentioned, Erica, why are they misdiagnosed so often?
So it can be a confusing time in the beginning. With the latent autoimmune type, your immune system hasn't completely destroyed your pancreas, so you still have a little bit of production of insulin. You still have a little bit of your own insulin, which can make it look like, oh, well, you still have insulin, it's probably type 2 diabetes. Let's give you medication to make that insulin work better. But actually what's happening in the background is that your immune system is slowly destroying your pancreas. So your ability to produce insulin is going down, and the medication won't be able to make use of insulin because it's not being produced. So it's important to get the right diagnosis so that you can get the outside insulin if you need to inject insulin, so that your sugars are being moved out of the blood with that insulin, they're not building up.
And when you work in Coventry in a specialist hospital for diabetes, Petya, you see these patients on a regular basis. When your patients are, there's a question if it's type 1.5 or type 2, how do you deal with them, and for how long do you give them before you test them further to possibly diagnose them more specifically with 1.5 diabetes?
So initially, if they have presented in a way that makes us think it's type 2, they will probably be started on oral medication. We'll leave them for maybe a month or two, depending on how high their blood sugars are. Obviously, that will depend on your individual situation, and it's ultimately your doctor's decision. If the medication started, the low dose doesn't work, we'll increase the medication. But even if you're taking your medication, you've kind of cleaned up your diet, you're eating the foods that will help you manage your blood sugars, and you're still having high blood sugars, that's when you should go to your doctor and really tell them, look, what I'm doing everything that you've told me to do. Can we consider other options? And there are further tests which your doctor can send off. They're only done in very few specialist centers, but they are available to you if it looks like maybe we haven't got the right diagnosis.
So there is a type of test that you can do to maybe get a better diagnosis. What are these tests, Petya?
So there's 3 tests that we usually do if there is that suspected diagnosis or we're not sure what it is. There's 2 tests which will see if your immune system has produced antibodies towards the cells in your pancreas. So that will tell us, is your immune system attacking your pancreas? And the 3rd test shows us how much insulin you're producing. So whether it's because of your immune system or a different reason, that test will show us, are you actually producing insulin or not?
Thank you so much for clearing that up, Petya. And now we're going to move on to gestational diabetes. Petya, can you highlight what is it and why does it happen during pregnancy?
Yeah, so gestational diabetes can only happen in pregnancy. And unfortunately, it's becoming more and more common. So about almost 1 in every 5 pregnancies will get that diagnosis. And the reason it develops only during pregnancy is because you're kind of growing an extra organ, the placenta that's around the baby. And the placenta produces extra hormones that make your insulin not work as well. So they make you more insulin resistant. And what we think is happening is before you got pregnant, if due to poor lifestyle or genetic factors, you already had kind of insulin resistance in the background, maybe just a little bit of it, and the placenta makes it worse, then your pancreas can't cope anymore, can't produce enough insulin to overcome the resistance, and your blood sugars start rising. Thankfully, that doesn't mean that after you give birth and the placenta is out of your body, it usually goes away, the insulin resistance and the high blood sugars. So you're no longer diagnosed with diabetes. But it is a warning sign that perhaps there is some background resistance, that your pancreas is struggling. And in fact, after you've been diagnosed with gestational diabetes, you have a 1 in 2 chance to develop type 2 diabetes in the next 5 to 10 years. So it's pretty much 50-50. Half the people will develop it in just 5 to 10 years.
So it should be a warning sign to look into possible lifestyle causes that could be now pushing you from a gestational diabetes to pre-diabetes, and even it might lead you into a type 2 diabetes unless we address these root causes. And once you're diagnosed from within the healthcare setting, Petya, what should be done after this diagnosis? What tests and what follow-ups do we advise our patients?
So once you're diagnosed with gestational diabetes, you should be offered to speak to a dietitian to talk about lifestyle changes that you can make to control your blood sugars. And you will be followed up quite regularly while you're pregnant, because we don't want your baby to be living in a sugary environment that can cause a lot of trouble to both your baby and yourself. After you deliver the baby and you no longer have gestational diabetes, because of the higher risk of type 2, ideally we'd want you to have, in about 1 or 2 months' time, have a test with your GP to see if your blood sugars have gone back down to normal. And then every year after that, you would have a blood test to check what your average blood sugars are, to check if you are starting to go into the pre-diabetic and type 2 diabetes range. So we keep
actually,
those signs.
At this, it would be a really good opportunity to talk to your healthcare provider, whether you're seeing a nurse at your GP practice, or seeing a GP at your 6-week check after you've delivered your baby, and you've had gestational diabetes during your pregnancy. It's important to bring that up and get some advice, and make sure that is recorded on your record, so that we can keep an eye on your sugars in the years to come.
Thank you, Erica. Thank you, Petya. And that leads us into pre-diabetes and type 2 diabetes. Lynne, could you highlight what this disease is and what to look out for?
Okay, so pre-diabetes is basically a warning sign that type 2 diabetes is on its way. It's diagnosed when your HbA1c is about 42 to 47. Basically, it occurs when your muscles and liver have become resistant to the effects of insulin, which results in a build-up of glucose and insulin in the bloodstream, because it won't enter the cells. And there's now strong evidence suggesting that the chronic complications that we can see as a result of type 2 diabetes begin occurring even in your pre-diabetic stage. So that's things that affect the kidneys, your eyes, your nerves. And this is where we see a lot of patients in general practice, and we try and help them to lower that risk of type 2 diabetes. And actually, it's gotten a lot worse since lockdown. We're seeing a higher number of patients in the pre-diabetic stage. Type 2 diabetes follows if you don't get control, and it can be defined as an HbA1c of above 48. There is type 2 diabetes with non-insulin, and that's where your body is still able to produce some of its own insulin. And type 2 diabetes, insulin dependent, is where unfortunately the body is not making enough of its own insulin, and therefore we have to supplement it. And there is an increased risk in these insulin resistant states for complications such as hypertension, high blood pressure, high cholesterol, fatty liver disease, chronic kidneys disease, blindness and neuropathy. And again, there's been a massive increase in the past year or so since lockdown occurred of people being diagnosed now as type 2 diabetic. The signs to look out for include thirst, dehydration, like excessive thirst, dehydration, frequent urination, tiredness that's just not explained, and yeah, that's basically your type 2 diabetes in a nutshell.
Thank you, Lynne. Both of you, Petya and Lynne, you have noticed, you have highlighted that actually these cases are increasing, both in gestational diabetes as well as in type 2 diabetes. And we could really see this during the pandemic. Even in emergency setting, we are seeing many more complications presenting in A&E from diabetes, cardiovascular disease, heart disease, kidney disease, and so on. So we can see in front of our eyes that lifestyle and how we treat our bodies and what we eat does have a great effect on chronic diseases. And in our next session, we will be talking about insulin resistance and how, like you said, Lynne here, how it is one of the major culprits in most chronic diseases, and understanding insulin resistance is key in preventing, treating, and reversing chronic diseases with lifestyle. And we will be looking into what are these lifestyle changes and dietary changes based on the most up-to-date evidence that we have right now to address diabetes and other chronic diseases. So thank you so much for today, for highlighting what is diabetes and the beginning to what is going to be our series on how to address, take control of diabetes.
Sorry, Linda, could I just add something here?
Absolutely.
Just to say that I don't want to confuse people that actually type 1 diabetes is not something that, although it's not something that we can prevent and cure, whereas type 2 diabetes, it is preventable and as we mentioned earlier, in most cases even reversible with the right, with the optimal diet and exercise and lifestyle. Although as I said, type 1 is not preventable and curable, it is still important to optimize your sensitivity to insulin and preventing insulin resistance even in type 1 diabetes through an optimal diet and lifestyle, which we will be going into in more details in the upcoming sessions.
Absolutely. So if you would like to find out more about that, do tune in every Friday at noon. All of the conversations are recorded and you can find them on YouTube and Facebook at Afternoon Tea and on our website, afternoontvdocs.com. And in the next session, as we mentioned, we'll be talking a little bit more in detail about insulin resistance and what you can do about it with your lifestyle. In the future, look out for our course that will be coming out in January on preventing, treating, and reversing type 2 diabetes. And this will be available free of charge in Somerset and Taunton region. And it is funded by the amazing Dandelion Seeds Foundation. To find out more about them, you can check them out on their website and Instagram and Facebook as well. The link will be provided in the comments below. Thank you very much for today, ladies, and we are looking forward to having you all joining us next Friday. Thanks, guys. Bye.
Bye.
Bye.